My name is Thomas Sellers, and I'm an orthopedic surgeon at Southern Orthopedic Surgeons. I specialize in upper extremity surgery, including problems from the shoulder to the hand. I'm originally from Montgomery. I was born and raised here until I left for college. I went to medical school at UAB in Birmingham and did my residency training in orthopedics in Tampa, Florida. After residency, I completed an additional year of training in hand and upper extremity surgery back in Birmingham at UAB. Perhaps my favorite thing about my job is the variety of patients I get to take care of. I see patients of all ages, whether it's small children with congenital problems, young athletes playing competitive sports, or people in their 90s who come in with more degenerative problems, and everything in between. It certainly keeps things interesting and makes every day a lot of fun. I view myself as an orthopedic specialist, not just a surgeon. Although I enjoy surgery and love to fix things, I find that a lot of musculoskeletal problems don't require surgery. And if we can get you better without an operation, that's generally my first choice. I also make a point to get to know each patient and individualize their treatment because although two people may have the same problem, they may have different expectations, goals, or desires, and that plays heavily into our treatment. So I make an effort to involve the patient in the decision making process so we can come up with a treatment plan that suits their particular needs. I treat a wide variety of problems, primarily focused on the upper extremity, and that includes arthritis, rotator cuff problems, complex problems of the hand and wrist, and really everything in between. I'm trained in microsurgery as well, and I treat a lot of nerve injuries and issues with peripheral nerve compression. As far as unique treatments go, I do treat a lot of patients with Dupuytren's disease and with contractures of the fingers. And while some of the more extreme cases require an operation, the vast majority of these cases I can make much better with a pretty simple procedure in the office. And this just involves a little numbing medicine and a small needle. And that's been very effective for me, and patients are generally quite pleased. I also offer an endoscopic carpal tunnel release. Carpal tunnel syndrome is a very common problem, so this is probably the most common surgery I do. And while the traditional treatment involves an open approach at the base of the palm, an endoscopic release allows me to make very small incisions, and we think that helps patients get back to normal a little quicker. Being from Montgomery, I always knew I wanted to come back home and serve this community. SOS has a long history of providing care to the river region, and it was a good opportunity for me to come back here and join the group, and I feel very fortunate for that. We've really built a full service orthopedic practice with multiple subspecialists, and we continue to grow each year. And this has allowed us to provide world class care right here in Montgomery.